Welcome back to ABC 7 Extra Sunday. I'm Mark Ross, and tonight we're talking about El Paso's measles outbreak with ABC 7 medical contributor Dr. Okachika Alozi with Sunset West Health and El Paso's Health Authority Dr. Hector Ocaranza. Dr. Ocaranza, I know we're calling this an outbreak. What actually qualifies this as an outbreak?
Well, more than 2 cases in a community might be qualified as an outbreak, but I know that many people ask us, well, when are we going to be appear as an outbreak area based on the state classification? And it takes a lot of factors. It takes whether this virus is spreading throughout the community, whether we have some other factors that are related to the epidemiology, whether this is going to be something that is going to create a bigger problem for the community. So there's not an easy answer as far as that. Definitely we'll call it an outbreak, and some of the cases that we're seeing here are related to the ones that they have in West Texas. Even the cases in Mexico, they have relation to the Gaines County cases.
All right. And Dr. Alozi, being an infectious disease doctor, are you surprised by this measles outbreak here?
Nothing surprises me at this point, right? I think it's more of a question of, I mean, and I defer to Dr. Ocaranza, but my sense is that if we look at the totality of Texas, we probably have some of the highest vaccine rates in the state, right? And so I think that we will be protected a little bit because of that. But does it surprise me? No, because like I said before, vaccine hesitancy is not new today. It's not a 2025 conversation. This has been going on for a while. I also think it's a side effect of success. Right? We haven't seen measles for almost 20 years in most places in America, and out of sight is out of mind. And so that's part of the health issue there.
All right, these next few questions are for both of you. In an interview last month, Health and Human Services Secretary Robert F. Kennedy Jr. made a number of misleading and unsupported claims about measles. So let's go over these one by one. First, Secretary Kennedy claims the vaccine's effectiveness declines by 4.5% per year. Is that number accurate?
Well, we need to look very carefully as far as how they're bringing a lot of those numbers. One thing that is important to tell the public is that you have questions, talk to your healthcare provider, talk to your doctor. That's the one that is going to tell you a lot more and dissipate a lot of those questions. Instead of going to Dr. Google, instead of going to the Facebook, which many times is going to give the wrong kind of information. We are the ones that are professionals that can discern a lot of the science, and we need to go to the science. We need to go to actually what has been proven, so we can give you that straight answer whether this is the correct path or we need to look in a different direction.
But again, you also told me off camera that you can go and get tested. I mean, people, there is that expense, but people can go and get tested to see if they have those antibodies in their system to prevent measles from occurring.
That is correct. That is correct. People can go and get checked and see if you have that protection, but it's not 100% protection because you still have the chance. When you're surrounded by a lot of people that are going to be having the measles, you have a chance to be sick with the measles as well. It is an interaction between 3 things: the host, which is the person, the virus, and the environment. So when all those 3 aspects combine in the right way, you're going to be sick. And because people must say, then why am I going to get vaccinated if it's not going to be 100% proof? Well, we cannot be 100% sure, but death and taxes, as they say.
That's right, indeed. Now, let me ask you this question, Dr. Alozi. Secretary Kennedy claims the measles vaccine, quote, does not appear to provide maternal immunity, unquote. Your thoughts?
So I remember this conversation. I actually don't know what he's talking about. And so I think that's concerning, right? When you aren't even sure what they're speaking to specifically, there's a concern there. I think what's important is this, right? That's not necessarily what the MMR vaccine is trying to do. You get MMR vaccine usually within the first 5 years of your life. There's 1 dose and there's a second dose. First dose confers about 93 to 94% immunity. Second dose gets you in the 97 to 98%. The actual effective sort of rate of protection over a population of 100,000 is almost 99%. Now, we give children the vaccine because, in a sense, he's right. We don't expect maternal antibodies to completely protect the child, so we give them more vaccine, and which is why they don't get it in the first 12 months of life, because there are some maternal antibodies that give them some mild protection until they hit 12 months of life, and then we start the series. So I think it's one of those things. You can play around with facts and figures all you want to make them sound as cute and as sexy as possible, but I think the take home here is that he's trying to downplay the science of vaccinology, which we know is concrete and works immensely well.
Now, Secretary Kennedy also claimed the measles vaccine, quote, leads to deaths every year.
Well, what we can say for sure is that measles is going to be killing people, and we're seeing it right now, and it's tangible.
The vaccine itself.
The vaccine itself, I don't believe all the vaccines might have some side effects. Then for the vast majority, are going to be very mild. We cannot instill fear into the people saying that it's going to cause death by getting the vaccine. The chances and the risk that you're going to be dying from the disease is greater, and that's what we need to continue telling the public.
Finally, the Secretary claimed vitamin A, cod liver oil, a steroid called budesonide, and the antibiotic clarithromycin could be used to treat a measles case. I'm seeing.
I feel like I'm in the Twilight Zone. So I think a couple of things, or a number of things. It's important for people to realize that antibiotics, clarithromycin, amoxicillin, Bactrim, do not treat viruses. Right? We've known this for decades, generations. I think that's important. There's a role for vitamin A in pediatric cases of measles that are severe. And the American Pediatric Association discusses it, how you dose vitamin A based on weight. There's no prophylactic effect of vitamin A. Multiple studies have been done in third world countries, Nigeria, where I went to med school. We know this even there, that vitamin A does not prevent or protect you from measles. And a host of the other things that he talked about, I mean, I sort of call that witchcraft more than anything else. And I mean, the reality is this, science is science, the vaccines work. If you get measles and your child is sick, you need to get them to your physician in their hospital as quickly as possible.
Still ahead, we'll ask our doctors if they're concerned about spike in measles cases with school ending and summer vacations beginning. Stay with us. You're watching ABC 7 Extra Sunday.